The role of psychological support, particularly in oncology, is huge. And I think as soon as you put it on a par with the physical aspects of medicine, in a sense it becomes almost trivial. We wouldn't give people chemotherapy without anti-sickness drugs. Why would we treat someone with a disease that clearly has a significant psychological impact without offering psychological support?
When I was diagnosed, it happened very quickly. There's very little time to think about emotional stuff, but it does build up. I didn't want to explain it to everyone. It was just easier to pretend that everything was fine. And before I knew it, years and years had passed, and my coping mechanisms, which were at the time I thought were fantastic, were not really doing anything. I wasn't moving forward, and that's when the depression set in. Cancer is a life-changing thing. The diagnosis can be very brutal, and the treatment can be very difficult. You have to put pieces of your life back together.
The most difficult thing to deal with was the feeling that my whole life was now totally out of my hands. I had no control or influence over anything. The sort of cancer diagnosis plus the really bad effects of treatment makes it virtually impossible to carry on as normal.
When people come into the centre, very often people they've come for results, they've had scans, and they're very anxious. We'll sit with them, have a cup of tea and a chat. We can signpost people onto other services or refer on to the psychological team. We have courses to help people that are living with cancer. We run the HOPE course for people that are dealing with the emotional side effects of cancer.
Working out whether someone needs psychological support can be quite variable. I mean, sometimes it's quite obvious. You can sometimes spot it as soon as you walk in. I do also explicitly ask about how's your mood, how much are you doing, how are your children. So I deliberately ask about those wider psychological issues in the hope that that then gives patients permission to talk about them.
I found it quite hard to communicate the way I was feeling with family. The CNS nurse goes through a whole holistic assessment, really. She doesn't just ask how you're feeling, whether you've got tingling feet or not from the chemo. She goes through absolutely every aspect of your being, mental, emotional, physical.
You're not just looking at someone's physical needs. It's not just about having the knowledge of the cancer treatments, that's part of it. I see very much as my role as a CNS to guide them through their treatments, but also acknowledging that certain points of their treatment may be more stressful, and also considering their emotional and social aspects of the person, not just a person with cancer.
My CNS nurse obviously picked it up that I was certainly not myself at all, and she referred me to the psycho-oncology service, which turned out to be a huge blessing.
Not everyone will need to see a clinical psychologist. We know that for a number of people, their emotional difficulties are such that they will be able to manage them effectively using their own resources. But for some people, their difficulties are so significant and are impacting so much on their day-to-day functioning that they would benefit from seeing a clinical psychologist.
For us, it's been critical having psychologists in the team, and I think it's important for the patients to know that we all work as part of a team. We're all there to support them and help them through their treatment journey.
When the CNS nurse first suggested seeing someone in the psycho-oncology team, I was a little bit sceptical because that's not something I've ever gone for in my life. But I was proven to be wrong in my scepticism. I had a very positive experience and completely changed my view of that specialism.
The advice I would give if you find your life going awry, going sideways, is ask for help. There are people there, professionals that can help you and put you back on track.
There's been a lot of research that shows that if patients if they're very well psychologically supported and if they feel like they're going through the treatment journey, very supported either from their CNS, from their doctor or from psychologists, they actually have a much better outcome than if they're not supported.
Just speaking about it, the relief of it was the most amazing thing. We did exercises and worked through my issues one by one, and I no longer feel overwhelmed. Things can be broken down and worked on little by little, and slowly I think, things are getting better.
Tell people how you're feeling, both physically, mentally and emotionally. There is a huge team of qualified people that not only can but want to help you. So send up that flare.